Hello everyone, we are going to discuss an important topic in radiology under the headline of emergency radiology in abdomen. There, this session is going to make you understand about the common abdominal emergencies in radiological aspect. We are going to discuss about acute appendicitis and radiology first. And what are the clinical features of acute appendicitis? It is the periumbilical polyp pain shifted to right iliac fossa. You know, everybody, the pain starts in the umbilicus and shifts to the right iliac fossa. This is very classical for the normal right-handed person or normal persons who has got a normal descent of the appendix from the right hypochondrium down to the right iliac fossa in usual maturity population. But even there is left-sided decubitus inversus states and descent of the appendix may not happen, so the pain may be of different type. We are going to discuss about the usual maturity population symptomatology. And the fever may be between 98 to 102 degrees Fahrenheit. There may be nausea, vomiting, and diarrhea, and there may be features of intestinal obstruction. What about the university finding of acute appendicitis? We are switching all other things, just going to the maturity highlights of the disease aspect. The acute appendicitis in ultrasonography shows a non-compressible blind-ended structure. It is located in the right iliac fossa. It is a peristaltic tubular structure, and the base of the appendix is located behind the cecum. The wall thickness is more than, somewhere written 4 millimeters, somewhere it is written as 6 millimeter. And there is a must you need what is the superficial probe application for the detection of acute appendicitis sonographically. What is a superficial probe? We can come to know later on. This is a slide of acute appendicitis seen here. This slide has got a flat surface over here. Because of the superficial probe is applied here. The symbol is the abdominal probe is for the larger organs to see, like the liver, the kidneys, the spleen. Those organs are larger in terms of centimeter. Multiple centimeters are started through the abdominal probe. And what about the superficial probe? It is for the sub-centimeter or few centimeters. So the superficial probe really goes through the superficial structures like appendix, the subcutaneous structures, the breast, the neck, the superficial lymph nodes, the axilla, like this. So the multiple centimeters are gone through by an abdominal probe, and the superficial probe goes through a sub-centimeter and the nearer lesions near the surface. And this superficial probe has got a flat surface like this. You can come to understand that superficial probe has been applied here. And subsequently, this is the abdominal probe. You know, it has got a convex surface. This is also an appendix seen by an abdominal probe. and a large appendicolith is here. So this is an abdominal probe. It has got a convex surface. Area is presented as convex lines here. And whatever plain X-ray can contribute to the evaluation of the acute appendicitis, it has got a limited value in diagnosing acute appendicitis. This is only applicable in detecting free gas in appendicular perforation and results free air under hemidiaphragms. And detection of the appendicolith provides a possibility of acute appendicitis in cases of acute abdomen. And the 90% possibility of acute appendicitis raises with the presence of an appendicolith in RIF. So this is a clue to the acute appendicitis to be a cause if you get an appendicolith in plain X-ray. There is a small bowel dilatation, small bowel obstruction pattern of the bowel distribution in abdomen in cases of 40% abdominal radiograph because of the acute appendicitis causes the partial ileus along the right iliac fossa where there is termination of the ileum and right colon starts. So the ileus of the ileum provides such scenario of small bowel dilatation, small bowel obstruction pattern. This is the plain X-ray. You see there is a calculus noted in the large radio picture noted in the right iliac fossa, a large appendicolith. And what about CT? CT gives a dilated appendix with diameter of more than 6 millimeter and wall thickness more than 2 millimeter and adjacent mesenteric fatty stranding and mesenteric lymph nodes and appendicolith and periintestinal fluid. Increasing diameter alone can be seen as an early find in acute appendicitis in CT scan. This is a photograph of CT scan showing an inflamed appendix, appendicular edema, small periintestinal fluid here, and a small calcific density here presented as appendicolith or ficolith. And appendix is diffusely enlarged, 2 centimeter in dimension, walls and edematous, small periappendiceal fluid was there, stranding of the adjacent fan and minimal extraluminal fluid, tiny calcific densities may be appendicolith. So this is one part of the acute appendicitis about emergency radiology today. And the next day we will go for the rest part of the acute abdominal conditions. So today, thank you everybody.